Gujarat will be the first state. And my compliments to all my colleagues from Gujarat government. I take myself that over a period of last almost 5-7 years, I have become at least a semi-Gujarati, if not total Gujarati. So having interacted with all the government hospitals of Gujarat government and being an integral part of the family, I feel that we as a team are more belonging to this place than any other place. And so also with the private hospital, we have been fortunate to be interacting with both the public and the private hospital in the state of Gujarat. And I must share with you, the feeling is wonderful. The feeling of elate that comes from everyone who's been part of the program. The feeling of pride that comes from everyone. Right from the time we started our first sensitization in the training institute at Sola, where about 300 people gathered for the first talk. And at the end of it, I remember I felt that I was a fool. Because we tried to teach them, and then we realized that until unless we have the standards in Gujarati, we cannot teach them. And that's where a very huge initiative, which I think everyone in the Gujarat government needs compliments, the translation of standards into Gujarati got started. And that's how, when we say in the parlor of quality, that chairman to doorman, everyone is to be involved. In the Gujarat, everyone got involved. And more than that, there was a sense of pride in everyone trying to do that. I remember the words at the initial stages when we were told, accreditation will come, but the happiness is when the improvement comes, and improvement has taken place. And that is what has resulted into this conference today. Over a period of the experience of last few years, as the journey to accreditation is going ahead, 14 institutions got accredited. There are many others who are almost reaching that stage. They have undergone pre-assessment, they are undergoing final assessment, there are a few who have undergone final assessment, they are just going for the review. So it has become a continuous exercise. On the other hand, hospital like Civil Hospital Gandhinagar, they are about due for surveillance audit. So now I think a cycle has started where we will be continuously, either there's a pre-assessment going on, or a final assessment going on, or a surveillance assessment going on. There's something which is going on at all the times in various hospitals. And that is what has resulted into the processes. The processes have to be continuous. They are continuous, and they have resulted into what we are talking of, best practices. The whole thought when it got started, and I remember the Commissioner Madam, when we had a meeting with her and she advised us on sharing of these best practices, that now that we have reached a stage when they are maturing, when they are actually giving results, when we have got the indices coming out of it, when the trend are showing that yes, the quality improvement which was only a thought, a vision, is now actually is visible on ground. It is giving results. Why not propagate it in a much bigger manner? Why not bring our private colleagues also around who have developed some of the best practices in their own fields, have their own experiences, and share it with across everyone, because that is one thing in India in which we have always been little slow. I always feel that what I did is my proprietary right. Why should I share with others? If I have reached a particular pinnacle, if I tell someone else, he or she also may reach pinnacle, why should I share? And that's where I think the Government of Gujarat, the Quality Council of India, the Indian Healthcare Quality Forum, we all came together to create a platform where we start an initiative of sharing the propagation of the best practices. We tried to reach almost all the states in the country. We tried to reach all the private institutions and requested them to send them their entries for the best practices. And I must say, though initial first time kind of thing in the country, but yes, there have been response from other states, there have been response from our private partners, and I think what we have been aiming at and what Dr. Girdhar Gyani and others have always been talking about, that healthcare quality coming at the horizontal level, not at the vertical level. Having few vertical towers of excellence are never going to result into healthcare quality. When the healthcare quality reaches a pure horizontal level, it's going to reach everyone. And the primary healthcare centers and others getting accredited, the message going on that, and the spread of whole thing occurring, I think is something which has created best practices on one hand for the towers of excellence. We have people from Apollo, Sterling and others sharing their experiences. On the other hand, we have a situation when we are talking of a private healthcare system, the primary healthcare system also sharing their best practices. At the same time, all these initiatives which are being taken at the NRHM level and others, which have actually created results. They have actually created success. If India today is looking at being a healthcare situation where they can be globally compatible by 2020, I think the efforts of everyone sitting on the dais or sitting across the dais, I think is the most valuable part of it. And the conference theme today is actually aimed at that. We will be sharing something today on the dais by picking up whatever we could. In the limited amount of time, you can share limited knowledge. But I think more than that, you all be able to network with each other and hopefully carry up this dialogue in the time to come to make it sure that what we started today moves forward in the overall scenario. And as was suggested, that those of you who have come from outside, if they could visit the take out time to visit the facilities. I know many of them have visited yesterday. Large groups have actually gone across the primary healthcare centers and the civil hospitals yesterday itself. But those who haven't had time yesterday, they could probably stay back and plan it tomorrow. And what we will be too happy to share, we'll be too happy to give what we can. I think all of us across the state are geared up for hoping that what started at Gujarat becomes a national movement. I think that is a true sense of pride for all of us in Gujarat, that yes, this has happened at the national level, and the aim which the Quality Council of India and Indian Healthcare Quality Forum and others, they started working on it, I think will be more to a fulfillment. With this, ladies and gentlemen, we hope that the theme that will be picked up today will have its message for coming decades and actually shape up the destiny of Indian healthcare quality, the destiny of Indian healthcare best practices, and we would be able to achieve practices which are globally compatible but suitable for the Indian environment. Thank you very much.